Hey, everybody. We're kind of letting everybody get in and dealing with some connection issues for some people. So while we're kind of waiting, let's use this time instead of just sitting and hanging out, and let's open it up to Q&A. Anything goes. Stuff from yesterday or just anything. Right off the bat today, we're going to delve into skin and hair and all that. But after lunch, we're going to do immunity, respiratory, and psychological.
And because I'm doing this, yeah, perfect. Thanks. Just unmute yourself and talk.
Hi, Greg. It's Robert.
Hey, Robert.
Good morning. I have two questions. The first is, actually, I have three questions. The first one is about some clients that I'll be taking on in the next month or so. Okay. The lady who's contacted me has 8 boys, ranging in age from 4 to 17. And they are currently in the custody of their father, okay, who is reportedly abusing them. And they expect the custody.
Like physical abuse or sexual abuse?
Physical, sexual, emotional, verbal. Okay. And she expects the custody situation to change in the next 1 to 2 months. So our current tentative plan is to use the abuse protocol that you gave them one of the other study groups earlier this year. And that's great for the kids that are 9 and up, but there's 2 of them that are under 9. What do we do about them?
Like, so they're 4, and what's the other age?
4 and 7.
Boy, okay.
And I can certainly take one of the oils from the infants and children's kit so that they feel as a part of the group, and I know that will help them achieve that same change, but I don't know which one or how.
That age, usually what I would use with something like that would be Melissa, and you could use the Melissa spray rather than having to use the essential oil.
Okay.
And spray them down. You can even make them little bottles. I would probably really like to see them use it at night, like right before they go to bed, and even spray the pillow, just because they're going to be processing, especially that age, they'll be processing way more in their sleep than during the day. Even go through and do healing, it's really going to sink in more in the time that they're asleep. And so the Melissa, Melissa does a lot of things, but especially for children, it's unnerving, it's very calming and soothing to the nervous system, it's very activating to the heart, but it also it's very strengthening to the heart. And in these kinds of situations, it really is about getting people to helping to facilitate them integrating something in the heart so that it can be transmuted and let go of, and or move past it, because a lot of times managing the uncomfortable feelings becomes a full-time job, and it starts to almost become a little bit of their personality. So the more that you can get them to integrate these things at the age that they're at, the more that, I don't want to say they'll have a clean slate as they're a teenager or older, but they won't be managing the situation. They won't be managing their feelings or the impact, because I'm kind of trying to weigh my words how to say it, and I'm just going to be super blunt about it, but a lot of our personality is not because of positive things. You know, a lot of it is because of conditioning that we've had to try to like remedy, manage, move forward, you know, move past it. It's affected self-esteem, self-image. You know, there's all these components, and there's these defense mechanisms that kick into play. And so part of our personality is about dealing with negative situations, and not necessarily about like just the positive things we bring forth. There's positive things in there, but the more that you can help them integrate it into the heart, the more that it doesn't like impact the makeup of their personality, if that makes sense.
Yes.
Like it's especially at that age, it's yes, you want to help them like process the trauma, but you don't want this to become, or you're trying to minimize it becoming part of their identity. And so you know, when you're dealing with this like after the fact, and say, you know, you're dealing with somebody who had this but they're in their 30s, the unwinding is a bit different, you know, because it has become a little bit of, you know, an impact on their identity and their self-image, and you're having to unwind that. You know, that's part of what you're doing. You're not just dealing with the trauma, you're dealing with the effects that the trauma have had on like their makeup. And some people kind of do it naturally. Like some people are able to like kind of process it and let it go naturally, but like for a kid, they don't have that makeup yet. They don't have the cognitive functions to be able to do it at this age. And so that's actually good and bad. Like the thing is like you can get it into the heart and let them integrate it and let them process it. And sometimes they can move past it kind of quickly and just like shake it off, you know. But like as they get a little bit older, if they haven't shaken it off, it starts to become like a thing that they're having to manage. And we all have stuff that we manage. It's just that you know, it's a little bit heartbreaking to watch somebody have to manage something like that. And so Melissa would be my go-to thing. Like everything else would be, it could be helpful, but it's about, you know, strengthening the nervous system and like fortifying the nervous system, I guess is a better way of saying it. And then helping it get into the heart to get transmuted. And so Melissa is very good for that. It's very strengthening to the heart. It helps people who are like real tender-hearted, who have been traumatized. When people have a hard time integrating something into the heart, you know, something painful in the heart, years of sadness and grief, all of those things Melissa is good for. And so it doesn't help you move past like how helichrysum does, but at that age, it's usually if you can just get it in the heart, they're so young that it's just, it kind of will resolve itself.
Now,
you know, as they get older, it takes more, but like sometimes when they're that young, it can be resolved kind of quickly.
So the 9 to 17-year-olds, the other 6 boys, should we follow the abuse protocol, or should we do Melissa for them as well and keep it simple?
You can start with Melissa, but it might need more.
Okay.
You know, especially like after about 8 or 9 years old, the mental body starts to kick in, and the self-image starts to change a bit, and you know, they actually are developing self-image. So then it starts to be, you're starting to have to wrestle with the mental body as well, where up until about 8 or 9, you're really more just wrestling with the emotional body, not so much the mental body, and it is a little bit easier to deal with. Then when the mental body starts to kick in, it starts to be a little bit more complicated. So probably going back to that protocol.
Okay.
Yeah.
Uh,
We can maybe refine it and streamline it and just do some bare bones. I'd have to go back and look at the protocol because I have different versions of
right.
things, and so maybe send me the protocol that you kind of want to use, and I'll go through and I'll look at it, and maybe we'll go through and just refine and not make it so complicated so that it's easier to work with the kids, because it doesn't need to be as complicated, as they get a little bit older. Yeah, abuse you can work on that for a very long time. Like,
Right.
you could write a book on how to go through and unwind it. And so,
Yes.
Sometimes I present like more simplified things, and then there's more involved things, and then, there can be years of protocols that can be laid out actually. And so it really depends, and it depends from person to person. That's the other issue is not everybody, the trauma can be different from person to person. They could all experience the same exact thing, but how it impacts each person can be somewhat different.
Yes, and
So yeah,
that's the later part as we begin to work on it and see what's working and what's not of the treatment. And I'm looking forward to getting into that part of it. Right now, it's like, oh, what do I do about these two young ones? And I don't want to oversimplify anything, but I also, any simplification can certainly help when you're doing it 6 or 8 times.
And the thing is you don't want to make it too complicated. Like, sometimes too complicated means that they won't do it, or you won't keep them in therapy as long. And the goal here is to keep them in a therapeutic setting so that they can kind of process and move past it. And the goal is always for them to outgrow the therapy, but to not walk away prematurely.
Right. Okay, so I have 2 other questions. Are we going to be covering treatment for restless legs?
Basal ganglia issues. I think I have some notes in the nervous system for basal ganglia.
Okay, I'll look that up.
Let me see. If I remember right, let me see what I have in here. If I remember right, it's like that advanced approach where you go through and you're doing cleansing and fortifying, regeneration. Hold on.
Yes, there's a basal ganglia.
Yeah.
Gray, Spudamine, Cape Snowbush, Cataract, Mimosa, Mastic, pain relief, inflammatory. Page 19.
19. Yeah, I mean, that's to re-educate the basal ganglia. I mean, potentially it might help with restless leg syndrome. Sometimes with restless leg syndrome, this is what I would explore first before you jump into this, is sometimes restless leg syndrome is actually due to a deficiency. It can be B12, it could be folic acid, or iron. Like basically the things that can different forms of anemia can impact the basal ganglia. If you're looking at it from the point of view of energy healing, because even like the pattern for these, like I didn't put the pattern in, but it's forehead, front and back solar plexus, Ming Men, and then the perineum, the soles of the feet, and then the jaws.
Okay.
And that's a way, like you can use that with electric violet, with, you know, doing energy healing. But every place that you're working, you're forming the intention that you're impacting the basal ganglia.
Okay.
The basal ganglia gets conditioned a lot. And, you know, part of the issue is it's tied to how we physicalize energy, like mental energy or soul energy. And so at times it can be very, you know, if it's very negative, which for most people, we tend to like physicalize more of the negative than like spiritual or positive. It's basically kind of tied to how like you somaticize something. And so you physicalize it into the body. And so if you look at like the pattern that I'm talking about, the forehead, the big solar plexus, the Ming Men, that's like when somebody becomes like really super hypersensitive to the environment. That's usually a basal ganglia issue. And you know, like you've been around somebody and it's like I feel like I'm walking on eggshells around the person, like they're about to get triggered like very, very easily. That's almost always a basal ganglia issue. And if you look at like when it starts to go more in the extreme, not so much restless leg syndrome, but you know, things like OCD are tied to basal ganglia function. And the issue, like if you have ever done like in-depth treatment with people with OCD, you know, it's not just the obsessive compulsive behaviors, but part of what they're doing is they're grinding on people. They're grinding on other people, on their behavior, what people said, what people did. And so and like when it gets really bad, they'll start doing a thing with their jaw where they start going, you know, and it's because all the energy is getting stuck in all these centers. The last place is it gets stuck in the jaw. And, you know, because the jaw is tied to some of the lower mental activity. And so going through and unwinding this, you would follow the same pattern with the oils, but like you're basically wanting to unwind the energy in these different centers, so that it's like you're changing the nature of the basal ganglia. And eventually what happens is it begins to physicalize like more positive energy or more spiritual energy. And so when that happens, it kind of changes the physiology, and it changes the tendency to get triggered as much. And so it doesn't mean you still couldn't get triggered. It's just it changes it a bit. And so you're able to pull out of it faster, and yeah. And so, you know, restless leg is in the mix there. It's not necessarily tied to OCD, but it's tied to just that like physicalization of the energy. And so you know, I manifest with the issue in the nervous system with the movement. And if you think about like sometimes when you have like expansion of consciousness, or you're about to like leave your body, like in like you're asleep and you're starting to like have an astral projection, like when you start to do like you're dreaming or something, your body will kind of jerk or tweak, or your legs will tweak a little bit. It's the same mechanism, but not necessarily negative there. Like your body's just getting like a twitch because consciousness is starting to leave. Where with the restless leg syndrome, it's harder for the consciousness of that person to expand out of the body. Like it still happens. It's just harder for it to happen. It takes more effort for it to happen. And so part of what you're doing here is you're unwinding that mechanism so that they can have that expansion of consciousness. Because the thing with the expansion of consciousness, it's part of how we heal the emotional mental body, is like, you know, having that expansion. And so going through and unwinding that allows for it to happen like easier. And so I'd still, look at, like, a lot of times I go to B12 and folic acid before I do the iron, just because the iron, long-term treatment with iron can cause constipation and things. Like, I knocked the other two things out.
Yeah, she's already tested. She's supplementing, I believe, on the B12. The others are fine.
Okay. Yeah. B12's, I mean, a lot of people have issues with B12. And so, yeah.
Okay. And one more question, and this is sort of a silly one, but as we buy oils and use them up, we have these bottles from the old oils. What do we do with them? Are they reusable?
They're for you guys, you could reuse them and make things and do blends and things. Like, for me, I can't reuse them because I have to always use fresh things. But around here we reuse them, and so for ourselves. And so
Right.
sometimes I make little blends, and sometimes I fill them back up again, or I have a big bottle and I pour like little bottles. And I have some oils by my bed, I have oils by my desk, I have oils by where I sit at the end of the day. And so sometimes I even divide up what I have. So say you have a 5 ml bottle, you put a little bit in here, a little bit in there, and a little bit there, so that I don't have to keep walking back and forth and trying to find my bottle. I have my bottle on the coffee table, and I have my bottle by the bed, and I have my bottle at my desk. And so you can do a version of that as well.
Is there a good way of making sure the bottle's cleaned out before it's used again?
Alcohol is always good. Like, alcohol will take out the smell for the most part. I wouldn't use like some flowery with like a peppermint bottle or something, you know what I mean? Like, have like things that are soft go with other things that are soft, and things that are harsh with other things that are harsh, scent wise.
Okay.
So that the smells don't get overwhelmed. But yeah.
Okay, thank you much.
I used to know somebody that she used to take her bottles and she would boil them, like put them in a pot and like boil them off, like, it's a way of disinfecting them as well. It seems like a lot of work to me. I just use some alcohol and clean them up, and then leave them open and let them dry out, and then they're usually fine.
Okay, great. Thank you.
You're so welcome.
Okay, so I know I have some hands raised here, but I
Sure.
just want to say sorry, guys. Glad a lot of you guys were able to get in. For now, I think we are set, but I don't know if you want to do some questions.
Yeah, we'll still do some Q&A.
Okay.
I mean, it's a kind of an anything goes weekend, so it's not that we have to follow any particular pattern.
Okay. So go ahead, Sahaj Nanda.
Hey, Sajananda.
Hi there. I loved Robert's question. I boiled a ton of bottles one day.
Yeah.
I just boil them hot water.
Yeah,
and
yeah, yeah.
dry, and it worked.
It's actually the best way to do it. It's just it's time consuming.
Yeah.
And so, yeah.
Yeah. But anyway, that was a great question. I just want to go back to yesterday because I was really interested in what you said about the cholesterol, and I was about to order the oils last night, and then I realized I didn't know which oils. There were just too many things I wrote. My notes were not clear. So I wanted to go over what you said, which you said, if working with cholesterol, rosemary, verbena, and cypress 2-to-1.
Yeah. So there is the, like, just to make it easy, there is the blend cholesterol support, which is already blended and ready to go. Or you can use rosemary, verbena, and then cypress, and 2 parts of the verbena to 1 part of the cypress. And then you take 2 or 3 drops in water daily. And so, we've had several people where they've gone through and they've done testing and everything. And I mean, it doesn't work every time, but it works a lot. Like it works kind of consistently. And I had a few patients where, they had just a super strong genetic predisposition. Like, there was one person, their cholesterol was almost 600. Like it was crazy. It was off the charts. And we put them on that because they didn't want to take the medicine. But I, my thing was like, you got to be doing something because like that cholesterol is, crazy. And so just by doing the rosemary, verbena, and cypress, we didn't even have them do the topical part. We got it down to like 220, and it was like in a short amount of time. So you have choices. So you have the rosemary, verbena, and cypress. And sometimes for whatever reason, and some women sometimes, instead of cypress, we have to switch to Spanish sage. But it's like maybe 20% of the time. It's not very much. So I usually still start them off with the cypress. I mean, the cypress is the most consistent. And so there's that. Then there is another oil that we have that is from the Ayurvedic tradition for treating cholesterol called Google, like Guggul. And it's a real resinous oil. It's a CO2. And that also is, I mean, I think it does a few other things, but the big thing that it does is it's for cholesterol.
Okay.
And so those work really well. And then if it's real high or if it's real stubborn and not going down, then I also have them use the digestive lymph blend, which is carrot seed, and then this really specific kind of rosemary referred to as rosemary camphor. It's a different chemotype than regular rosemary or the verbena. And I don't make a big deal out of it because it doesn't really have a lot of uses other than like cholesterol and some heart conditions. And, other than that, you don't really use it for a lot. So a lot of times I just kind of privately, like if somebody needs it, I give it to them, or it's in a couple of blends. But it's not that it's hard to get. I mean, it's not common, but it's just that if you took way too much internally, it could cause a little bit of problem. I mean, you'd have to work hard at it. You'd have to take like, 40, 50 drops internally. And, none of you guys are doing anything big like that. But in Europe and stuff, people take like massive dosages of essential oils, and I keep it down on the small side. Like I keep it down to like casual dosages, at most like maybe 3-4 drops, unless I'm treating something really crazy. And then we don't talk about it publicly. I just treat the person and tell them what to use, and so.
So how would you use that digestive blend? Just a couple of drops?
The digestive lymph, you actually rub on your body. You don't even take it internally. You and like that wasn't something I came up with. That was actually a French doctor is the one that kind of came up with that protocol. And even he said, like, I at first I just read this little piece and I was like, oh, that's an interesting way to treat cholesterol. And then I found that it was good. Like the rosemary, verbena, and cypress I felt worked better, but I felt that the digestive lymph helped to augment the treatment. Like it really couldn't stand on its own, but it augmented it. And so that's usually the way that I do it, is like I'll have them start with the cholesterol support, and then after a period of time, if we need to make adjustment with the Spanish sage, I do that. And then might have them try the Google, but if like just none of that's working, then I kind of switch over and I still have them continue with that. But then we start doing the topical thing where you rub it on your abdomen, but sometimes I even have them rub it on their back and their neck and shoulders, and that can lower it as well. So it depends. Do you know how high your cholesterol is, by the way?
It's like not that bad, but it is high enough that my doctor's concerned.
Yeah.
It's 230 or something.
Yeah. I mean, honestly, before they had the cholesterol meds, 240 was considered normal. And so like, way back in the day, and then the meds came out and all of a sudden the number kept dropping and dropping and dropping. And so like I always take it with a grain of salt. Like even 230, 240, it's like, yeah, treat it, but it's probably not a super big deal. Like, I mean, I would still treat it. You know, lower cholesterol is always better, but you know, they're basing it on studies and things too, but you know, the lower you get it, the better. And especially as we get older, the tendency is to have a little bit higher cholesterol as well. But the big one that I think is the one to be really concerned about is the genetic forms of it, where people just have crazy high cholesterol. You know, because I know people who have horrible diets, like horrible diets, like they eat everything wrong, and then when they test on their cholesterol, it's below 200. And then some of the people with genetic conditions do all the things right, like they are just regulated and their cholesterol will be 400. And so I mean, that is a very big genetic predisposition. It doesn't mean that the diet doesn't have an impact, but genetics plays a big role in it. So if you have the tendency to be high, you know, you try to lower it and keep it low just for overall health and everything. The other thing that cholesterol sometimes is a protective mechanism for like the veins and things. Like if the veins are real brittle, it can be a little bit of an issue for that. You know, it's a way to protect the veins from breaking. And so sometimes when there's issues like that, like I start to look at, like there's the potential, especially if they're not reacting to any of the treatments. And when I say treatments, I don't mean just like what I'm doing, but usually, you know, medical treatment, whatever, and it's just not going down. And then I start actually kind of looking at it from the point of view that the body is trying to protect itself. And I start looking at the fragility of vein issues, you know, vein health. And so increasing vitamin C, especially quercetin, is very helpful, and lemon oil. Lemon oil is really super good for that. Good for the liver as well, good for a lot of things. Has a strong tonic effect because it does so many things, but one of the things that it's very good for is helping the fragility of the veins and things like that. And so yeah, there's always that potential, you know, even like sometimes if you look at your skin, you see those little red dots. Not everybody has them, but like you might see like little red dots. They look like little super tiny moles. And you know, they're not a freckle. I mean, they're like kind of bright red, and it's, you know, a little capillary has like popped or gotten super dilated. And that is usually tied to a fragility of the capillaries, and it is usually tied to a vitamin C deficiency. And so you would go through and you would up the vitamin C to reduce the fragility in the capillaries. And so it's just one of those things that you could put in the mix if you're really wanting to be a full broad spectrum approach to treating it. You could go through and treat it that way.
Okay. Now, thank you. Then when you were talking about the cholesterol, you're also talking about something that really helps the blood. And a while ago, somebody told me that my blood was bad. I don't know exactly. I don't remember.
Meaning like viscous or
I think it's just I needed. I don't even know. It could be viscous. It could just be. It needs
so
to be
hyperviscosity. Like hyperviscosity was basically like thick blood.
Yeah.
Like thickened blood. Again, is lemon. Like, yeah, it's
lemon. Okay.
lemon has a thinning effect on the blood. And so, you know, it kind of goes well with the cholesterol issue, because it like say you have some blockages in the heart, like the thinner the blood, the more it can go around the blockages. It's not being held by the viscosity of like penetrating areas that have like a lot of cholesterol. And so it's kind of like the equivalent of like how they would have somebody who has heart blockages and has a high potential for like heart attack. They would have take 81 milligrams of aspirin. The aspirin is basically thinning the blood so that it's more able to penetrate the heart muscle. And so the lemon would be something in the same vein.
Just like
one time I had a patient come to when I was still seeing people in person in the office, and it was some guy that I had known for a long time, and he was super stressed out, and he was like a loan guy. He was always writing loans, and it's always a bank guy, and he showed up and he started having really severe chest pains. He was under like tons of stress, and he's when he started having the chest pains, he just walked in the door and he started having it, and he goes, I've been having chest pains all day, and yada yada yada. And I was like, dude, you need to call like 911. Like, this is like crazy, like this is life-threatening. And he was like, no. And I was like, this is happening. Like, so, I called the ambulance and just, tried to get him there as quickly as possible. And I turned and I just grabbed a big bottle of lemon, and I just had him open up his forearms and started just like showering his forearms with lemon. And I just trying to support it as much as I could. I didn't have an aspirin, because that's one of the things you can give somebody an aspirin in that particular situation, and it potentially is helpful. And so didn't have that. And, I didn't even have him take it internally. I just put it in through the skin. And I'd say within 30 seconds, his chest pain went away. And the ambulance still came and they evaluated him, and he was doing better at the time. And I think they took him into the ER and just did an evaluation. But he said after that, there was no more chest pain. Like he said, they evaluated him. They told him that he needed to go see his doc and get his medications adjusted and everything like that. But I don't think they even put him on medication, or he refused the medication. I'm not sure. But he said after that big dose of lemon, he wasn't having an issue. And so, he started taking lemon all the time. And he was always having the chest pain, and it stopped.
Mm-hmm.
I'm not telling people to self-diagnose, by the way, or self-treat. Like, that's a serious thing that needs to be evaluated by a doctor. But at the same time, it is one of the ways to like thin the blood and make the blood more able to penetrate the heart, which is what you're doing with aspirin. And so, going back to a cholesterol issue, like if the cholesterol is just really high and you're always concerned about it, it's a way to thin down the blood. When I was younger, I was going through the knee issues when I'd injured my knees. One of the doctors suggested that, because I had an overuse syndrome, and they actually kicked around the idea that it was hyperviscosity of my blood that actually had caused it. And just because of all the lactic acid and everything from the exercise and everything. And so I did a little bout of blood thinners for treating it, and it didn't really change anything. But thick blood can cause a lot more problems than just heart issues. Like it can cause, forms of tendonitis. It can, it can cause just all kinds of weird functional issues in the body, not necessarily medical conditions, but functional issues. And so if that is an issue, then lemon, I mean, lemon does so many things. That's just one of the things that it does. And so if you're not sure, I'd throw lemon in the mix. Like, I mean, it's super inexpensive. I mean, it's one of the cheapest oils. And I mean, it does a ton of things. And so, it helps to regulate mineral deficiencies. It's a treatment for anemia. It's good for the liver. It's good for, well, it's just good for a lot of things.
Sounds like a cure-all. How many drops?
Yeah, it's actually is considered a cure-all.
Really?
Like, yeah, there's a handful of oils that are considered cure-alls, like that and sage, and there's a couple oils. And lemon is actually considered literally in medical aromatherapy writings, it's considered a cure-all.
Good to know. How many drops would you use, like in water?
Most times I would say 3 or 4 in a day. You could go up to 8 or 10. I mean, lemon, I'm pretty liberal with. Like it's so mild and so easy on the body and everything that you could use it for, start with 4 and see how it treats your body and everything. But usually when I do it, I do like 8-10 drops.
Okay.
Yeah.
Great. Thank you.
So the only issue, like when you're taking bigger dosages, is that it does thin the blood. And so if you get a cut or something, you bleed a little longer.
Yeah. Yeah.
So I would not use it if you had some sort of bleeding issue, bleeding disorder, you're on blood thinners, things like that. And, anytime you're going in for like dental work or a surgery or a little procedure or something, at least 2 days before, stop using the lemon,
That's a good thinking ahead.
Yeah. Like, the one that people don't think of is a dental procedure.
Right.
You go in and the tooth pull or whatever happens just bleeds and bleeds and bleeds, because it takes down the clotting factor. And so, it is what it is. But yeah. The other thing, not so much for cholesterol, but if you're just like, since we're on the idea of like heart health and everything, is a few cups of green tea a day would be super good.
Okay.
Like it keeps the blood cells from like sticking together. Like it reduces the stickiness in the blood. And so you're kind of trying to do that with lemon, but the green tea doesn't thin the blood, but it just makes things like not as sticky. And so, I mean, that's not the medical way of saying it, but basically that's what's happening is you're reducing the stickiness. And so, green tea is good for you. It tastes good. And, a couple, 2-3 cups a day it's actually quite therapeutic.
Wonderful. Thank you so much.
You're so.
Go ahead, Peggy. I see you want to keep running.
Yeah. I don't mind.
Perfect. And this is
Hi, y'all.
Hey.
So, you. Okay, so it's really hot. I mean, it's really hot. So, Birmingham is like 95, but then the humidity is like 75, 80, 90. It's bothering me. It has not bothered me for a while, but all of a sudden, my body is not happy with it. Is there, that's the first question. Can you take Vitex orally, by the way?
Yeah. Oh, yeah, sure.
That was a tiny question. But yeah, heat tolerance.
Heat tolerance. That's a good one. I have to think this one out a little bit. Let's look up heat exhaustion. I want to say it's a bay laurel, but actually, you know what I would use is things that are good for stress. The hmm. Let me look up here. Why don't you try using like either spruce fir, spikenard, basil, something along that line. It's not going to cool the body, but it changes how your body processes, you know, because one of the issues with like heating, overheating is it does produce a stress response, and eventually it actually begins to overactivate the adrenals. And so you're trying to prevent the adrenals from being overactivated. And so, like, you know, spruce, like black spruce, is a way to support the adrenals. You know, Sylvester pine would be, but not so good for stress. But like the basil, the spikenard, the fir, all of those things are good for reducing stress and helping the response. So the idea would be not to let the adrenals get too overactivated, because if you're in something that's hot for a long period of time, the big thing that it impacts, you know, first it starts to impact the immune system, a little bit of the nervous system, but the big impact is actually on the endocrine system. And so you just want to keep everything, you know, regulated. I mean, like saying something like that, you could also use lemon verbena potentially. I mean, I've never used it for that application, but in theory, should have some sort of impact. And so even as I'm thinking this out, one of the things I'd experiment with as well is frankincense and myrrh potentially. So you know, I've never really thought this out for like, you know, dealing with the heat like this, but like you said, there is the big heat wave, and we had versions of this with athletes, but usually it was a combination also with like altitude. And so we were always usually a little bit more concerned about the effects of altitude rather than the heat itself. And so one of the ways that I would treat it like very quickly, like if they were just like hot and needed to cool down, is like I would put peppermint and like either aloe vera or like witch hazel, or like even in just like some alcohol, and then, you know, shake it up really good, and then do like a, you know, have them do like a rub down on their body. And just the alcohol itself helps to cool the body. You know, it's one of the old school ways of breaking a fever is to do an alcohol rub. And then the peppermint, because of the menthol, is very cooling. And then the peppermint also is very stimulating to the body's processes. And so it just helps the body to stay functional in those times. And so that would be like the short-term cure, but like when you're dealing with days and days of it, I'd probably go more to like the stress response, if that makes sense. And I mean, you'll have to experiment with this. Like I don't have like a tried and true way of doing this. Like I haven't really thought about how to treat this, but like mechanically, it's what makes sense.
I was gonna say in Ayurveda, ginger actually is cooling. So like if someone's overheating, they use ginger. I don't know if ginger oil would do the same thing.
I don't know if you could hear Samantha, but she said in Ayurvedic medicine, they use ginger to cool the body. So, yeah.
And then as far as application,
probably just topical, like on the wrist, inhale. I'd like the idea of putting in alcohol, like a liniment, because the alcohol would also be kind of cooling, and then just rub it on the body, like especially the torso. There's something about like rubbing it behind the ears, like the few times that I've had to treat heat exhaustion, I was in places where like, we were backpacking or something. And so I would just get like stream water and put it in like behind the ears and on the head. And that cooled the person down very quickly. And so you could do some version of that, of rubbing it behind the ears and everything. The peppermint might be a little too spicy for that area, but you can experiment with it. Yeah.
All right, we'll try it because it's going to be hot for a while. So we'll have
hot for a while. Yeah. Yeah.
and go ahead, Sonia.
Hey, Sonia.
Is it unmuted?
Yeah, you're good.
Okay. I was going to say about cholesterol. You don't want to get it real low because your brain is very high in fat and it protects your neurons. If you get it too low, it can cause types of dementia because the brain neurons are not protected. Also, the person who was talking about when you were talking about B12, if you have lead or thallium or some heavy metal toxicities, it prevents you from using B12. Your body can't use B12. It has it to change it to a usable form, and the heavy metals can prevent that. And so you have to use methyl B12. And then if you have
methylcobalamin or something like that.
Yeah, methylcobalamin.
Yeah.
But a lot of times in the stores on the label, it's just methyl B12.
Right.
But methylcobalamin, because it's a usable form. The other thing is when you do the testing, you need, a lot of doctors will just test the type of B12 in your blood. It's hard to find a doctor who does that to know if it's a problem where you're not processing B12. But when you do testing, you also do homocysteine levels, because if your homocysteine levels are high, it's an indicator of a genetic disorder where you're not processing B12. And you can just take the methyl B12 to help that. If it's still high, the genetic disorders are in the methylation pathways. There's about 6 of them. And you would have to give the enzymes that will bypass those genetic disorders. But if you have high homocysteine, you're not processing B12 and possibly folic acid, and you're also not able to throw off toxins very well. So some of the problems may be high toxins that are also affecting neurons and brain activity.
Okay, thank you.
And then go ahead, Deborah.
Hey, Deborah.
Hi. I'm really loving this weekend. Thank you so much.
Oh, you're fine. It's just a Tuesday night on steroids is all it really is, if you think about it.
I also really love how organized it is, because it helps me retain it and have a easy reference back. So
I don't think I've ever been accused of being organized, so thank you.
So just to follow up with this cholesterol,
Yes,
you
yes, yes.
mentioned the genetic predisposition.
Yes.
I know two people that have that genetic predisposition.
Yeah, it's actually quite common. Like it's more people are walking around with it than you would think. Yeah.
And one is actually on statins.
Yeah.
Her doctor is worried about her liver. It's a real big issue for her because she likes her little glass of wine. And evidently, I don't know what the results are coming back for her liver. Anyway, I thought, did you say that the lemon oil would not help if they're predisposed?
No, it still could help. Actually, the lemon oil is incredibly good for liver function, gallbladder function. It's good for a lot of just like toning in the digestive tract as well. But like anytime you want to do long-term support of liver function, that's like kind of non-specific, lemon oil works really super good for that. It's well tolerated. You could take big dosages. You could take it for the rest of your life, and you would be pretty solid. And so it's just one of those really good oils. And like we were talking about with Sahajananda is like there's a handful of oils that are considered cure-alls, and lemon being one of them. Like it does so many things that you can use it as a tonic because it's just good for strengthening the body, regulating the body, improving function. And a cure-all doesn't mean that it cures everything. It just means that a lot of times it does a lot of things, and when you're not sure what's going on with the body, it's something that you could use to bring the body back to a state of health. And so sage works that way. Lemon works that way. You could almost say rosemary verbena would fall into that category. What are some of the other cure-alls? There's like 5 or 6 that, boy, I used to use all the time, and I just got out of the habit of using them. But I'll have to look up what the other cure-alls are. But if liver is an issue, like if you're really trying to unwind the liver, helichrysum, Greenland moss, and carrot are invaluable, and even rosemary verbena, invaluable. And then if you're trying to just do long-term maintenance and keeping the liver as healthy as possible, lemon's a good way to go.
So that brings up 2 questions for me. Sure. The digestive lymph you mentioned had the carrot and something else in it. So, this is a person I've just introduced the oils to them. And the marjoram is working for her. She has the scoliosis issue.
Oh, sure.
But she gave me back every other oil that I had. But I'm wondering if 2 things. So the digestive lymph was rubbing on the body.
On the abdomen. And actually, the digestive lymph could be helpful for that. Given that she has scoliosis, lymph in the gut is going to be a bit of an issue. And also, the digestive calm would be very good for both her gut and her body misalignments.
So digestive calm would be just on, I saw you sort of rubbing your...
like rubbing on the abdomen. Yeah.
Okay. And she wouldn't need to use both, just the calm is what you're saying?
The digestive lymph would be more for cleaning up the lymph and trying to reduce cholesterol. The digestive calm would be calming down the smooth muscle of the gut, relaxing the diaphragm, relaxing the psoas, which are all wound up because of the scoliosis.
Okay, so if she was going to use both, she would let one absorb before she would apply the other one.
Right. And so
Okay,
the way to do that is do one in an alcohol or witch hazel base, let it dry, and then put the other one on, like in a massage oil base.
okay.
Yeah.
And if she was to do the lemon oil, I'm guessing with the statins, she's probably getting tested on a regular basis to see what her levels are.
Probably every 6 months. Yeah.
And so if there was any sort of change that she could correlate to lemon oil, at that time they would see it
The
and be
lemon
able to
oil is not going to
adjust.
lower her cholesterol. Like
Oh.
to lower the cholesterol, you'd need to use the cholesterol support or rosemary verbena with
Okay.
citrus. Yeah, the lemon would just be more supporting the blood and supporting
The liver. Yeah. Okay. So, but the same thing would apply though, that the cholesterol support, if she started using it 2-3 drops daily
Mhm.
in water,
Mhm.
then it would be picked up by the testing of her cholesterol,
Yeah, yeah.
and that would be regulated by a physician, and then she wouldn't have to worry about
Right.
any problems with, okay.
Yeah. You know, another one that lowers cholesterol that we don't really mention is helichrysum. Helichrysum actually lowers cholesterol as well.
Just from inhalation or
You'd still need to
application?
take it. You'd still need to take it internal.
Internal.
Yeah. With cholesterol, there's no getting around the internal thing except for the digestive lymph.
This
Yeah.
is a person who's also very OCD. So I'm guessing it all is from hearing you talk about symptoms that all of that would kind of works together as a personality compounding. I don't want to get overly
Yeah.
complicated.
That's just a basal ganglia issue. Like,
Yeah.
you unwind the basal ganglia a little bit. Yeah. We're
Okay.
actually going to talk about, we were talking about how we were doing this series of like next weekend is inner healing, which is tied to a psychological healing, releasing things in your sleep and like increasing dream time and things like that. And then we're doing the 4 directions, which is transforming the emotional body, like transforming, transmuting. And then in August, we're doing the class where we're doing the same thing, but for the mental body. And when we do the one for the mental body, we're actually going to be tackling the basal ganglia.
Okay.
Yeah.
All right. Thank you.
That's why you're starting to see like little things in the notes that like are talking about the basal ganglia is,
A good warm up.
yeah.
All right. Thank you.
We're going to go deep on the mental body, emotional body, and mental body.
And then go ahead, Mary Ann, then Angela.
Hey, Marianne.
I'm still stuck on the correct cholesterol. You get
Yeah, that's fine.
you get
Cholesterol
my
is a thing.
thinking.
Like cholesterol is a very big thing. Like,
Okay, I'm already on high doses of statins, which
Right.
I have been on forever.
Mhm.
And taking any of the oils, is that going to interact with what
No.
I'm already on? Okay.
No. A lot of times when I have people on, there's sometimes people don't want to take the statins, because they're concerned about potential side effects and things like that. And so I'll get people who are just wanting to treat it as natural as possible. But there's many times where people are doing the statins and the blend as well. And that I've never seen any sort of side effects or, negating the medication or anything like that.
Okay.
Yeah, no, everything's pretty solid.
And
And I assume you're getting your cholesterol checked like, once a year or something like
Yeah.
that. Yeah.
yeah.
So, just, monitor it and make sure everything's working. And do you know what your cholesterol is? I'm just curious.
Marjoram? No, not off the top of my head.
Okay.
But I should be taking marjoram
For which part?
for the hypertension.
Hypertension.
Well, I'm sorry, for the high cholesterol.
Oh, no, high cholesterol would be cholesterol support.
Oh, okay.
Yeah.
Yeah.
Which is rosemary, verbena, and cypress together.
Oh, okay.
Yeah.
And the other question, quercetin is a brand new thing for me. I've never heard of it before.
Mm-hmm.
And
It's a crude.
I do take vitamin C, but is the quercetin used instead of vitamin C or with it?
It usually, like when you get a formula, it has a little bit of vitamin C in it, but basically quercetin is a crude form of vitamin C. So it takes your body longer to process it. So it actually lasts in your body much longer, where pure vitamin C actually passes through your body within about 4 hours.
And
so
is there a dose?
The tablets I want to say are usually about 400 or 500 milligrams, and I would say
this is 500 milligrams.
Yeah, do like 2 or 3 capsules at a time.
Okay, and this says with bromamine.
Yeah, the bromelain is present to help you digest the quercetin, because it's a bioflavonoid. So a lot of times it's made from the peels of citrus fruits, and your body doesn't break them down very well. So the bromelain is mixed in with the quercetin to make you better assimilate the vitamin C or the quercetin, which is the crude form of vitamin C. A lot of studies where they studied the effects of vitamin C back in the old days, a lot of them were actually quercetin and not the pure vitamin C that you would take from like the drugstore or something, the chewable wafers. It's a lot of times it's quercetin.
Okay. Thank you.
Yeah, you're so welcome.
It's very helpful.
Good.
And then go ahead, Angela.
Hey, Angela.
Hi, Greg. First of all, I want to thank you for making yourself available for all of our questions.
Oh, my
really
pleasure.
Grateful.
Yeah.
Because there's so many unlimited functions. I'm pretty new with the oils, so when I'm reading through the workbook and things like that, and it says to add some to water, is there a suggested amount, like a minimum or a maximum?
If it's a real mild oil, you can just put it in like a little shot glass full, but a lot of times like 4 to 6 ounces, maybe, like a measuring cup full of water, a drop or two, and you can drink it. Like going back to we've been having this discussion with lemon, and you can do this with other oils as well. As you could take a big water bottle, put a few drops in, and as you drink your water throughout the day, you're getting the oil in too, and you're flavoring your water. So you could do a version of that as well. That's a very common way to do lemon oil, is people would just carry the bottle around, and every time they open up a bottle of water, they put a bunch in and then shake it up and then just drink it throughout the day. So a version of that would be okay, but rule of thumb would be at least 4 to 6 ounces. If it's more, that's fine, but you kind of want to be able to just to like throw it back. And so, you don't want to make the glass too big unless you're just also wanting to take in a bunch of water.
Right. And what do you mean by sustained inhalation? Do you actually close one nostril and then the other?
Yeah, well,
Sustained
inhalation would be like to hold the bottle like close up to your nose versus like having a diffuser in the room or something. And by going like this, you're inhaling through your nose and then exhaling through your mouth. By doing this, you're getting a lot more of the molecules in the respiratory tract, which eventually makes its way down into the lungs. And then as the blood passes through, you're getting the molecules of the essential oils into your bloodstream. So it's actually one of the best ways to deliver the essential oil. And so by holding it kind of close, it doesn't have to be super close, like it doesn't have to be in your nostril, but just like closer. And so, you can do the bottle, but one of the other things you can do is you can put a little bit, like say on skin or on a piece of paper. And by putting it on the skin, you're letting it open up, and you'll even get a little bit more that way. So you can like do it like that. So you can do it either from the bottle. If the oil is a little bit of an irritant, like sometimes some oils are a little bit sensitizing to the skin. Like you wouldn't want to do that with hot oils, or even some of the citrus oils, like orange can be a little bit irritating to the skin. And you could put it in the cap and then just inhale the cap. And then when you're done, just put the top back. And so in any version of that would be good.
Okay, great. And is lemongrass the same as lemon, or is it really different?
No, they're different things. So lemongrass is one of the other cure-alls, now that I think about it.
I love the smell.
Yeah, lemongrass doesn't quite have the properties that lemon does, but still very good for the immune system, for the nervous system. Very good for calming the body down, can be helpful for some of the digestive issues that we were talking about. It just helps bring the body back to a state of balance. And so very good for helping to calm down certain states in the involuntary part of the nervous system, specifically in the fight-flight response. Very good for that. Lymphatic function, very good for that as well. And so you definitely could use lemongrass on a daily basis, but that's one you definitely want to mix with water if you're taking it internally. If you're just trying to pull the body out of a state where the nervous system is out of balance, you can inhale it. But like if you're dealing with like infectious diseases and things like that, where you're trying to prevent colds and flus and things like that, a couple drops in water and drink it, and then still diffuse it in the room, because it will diminish the potential for you getting sick. And it's actually one of the things that we were using for when people were having their reactions from the vaccines, their body would get achy. A couple drops of lemongrass on water and drink it, and doesn't make all the symptoms go away, but it would definitely lessen the symptoms. And the other thing with lemongrass, that when you're bedridden, like you're sick and you've been in bed for a while, I think sometimes they call it like convalescence, or just being in bed for a long period of time sometimes can be hard on the body. Lemongrass is actually quite good for that. You can just diffuse that in the room. Like you don't even have to put it on topically, but diffusing it in the room can be quite helpful. And if you need to take it up a notch, I usually put some in like alcohol or witch hazel, and then just have the person like rub it on their body, like, their torso and their legs and everything. And it just helps the body to relax. And sometimes laying there for long periods of time, the body gets stiff, the body gets agitated, you start getting fidgety. And so the lemongrass can help with that.
So do you not put it directly on the skin? You have to mix it with alcohol, or is that just
lemongrass can be a little bit sensitizing to the skin. And so, I've put it on my skin a few times, but it does like kind of tingle a little bit. But sometimes for some people, it will actually kind of start getting irritated or burn a little bit. Only lasts usually for a few minutes, but I think Samantha one time spilled some on her skin, and it got pretty red there for about 15 minutes. And then, it passed. But if you mix it with massage oil or lotion or alcohol, it's fine. Just don't put it on the skin neat.
Yeah, that's kind of what I did. And I noticed that yesterday.
Yeah,
what about rosemary? I noticed rosemary, you've had in several different areas of the notes. Is that a good kind of cure-all also?
It's rosemary verbena is very good for sinus issues. It's good for circulatory issues. It's good also for bringing the body into balance, especially when there's a lot going on and it's not really clear what's happening. It can be very balancing and toning to the body. Very good for liver function, cognitive function, mental function. Rosemary is always good for those kinds of things. Can offset like brain fatigue and things like that. And so good for a lot of things. Also antispasmodic. So, you know, like yesterday we were talking about using it for joint and joint issues, and increasing circulation into joints. And so, you know, you could use it for a wide range of things. Yeah.
And that's ingestible also.
What's that?
It's
Is
ingestible.
that,
Yes, yes. Rosemary verbena is definitely ingestible. Yeah.
what if you just have regular rosemary?
Yeah, still ingestible. Regular rosemary is not quite as balancing as the verbenin, but still you could use it in a lot of the same ways. Verbenin's a little bit better for the liver and it's a little bit more balancing to the body, but a lot of times they overlap. Like for the joints, doesn't matter which kind of rosemary. For brain fatigue, doesn't matter what kind of rosemary. For sinus issues, kind of doesn't matter. But the liver and the body balancing, rosemary verbena is a little bit better. And for the cholesterol issue, rosemary verbena is better.
Okay, I just have one more question, please.
Sure.
So I had a hand surgery about a year and a half ago. I tore a couple ligaments, and instead of going through the palm, a lot of the damage was around the knuckles. So it was a surprise when I had a slice across my knuckles. A year and a half later, a couple of my knuckles still haven't went down in swelling. What do you suggest for something like that?
So right off the bat, I would do a couple waves of things. One, I would go through and I would treat first the area, especially incision sites and everything, with helichrysum. And the helichrysum will help to unwind the fascia. There's a good chance you have like basically scar tissue and fascial lesions in there because of the surgery. I'd unwind that and, you know, put it on neat on the area and do it daily for probably a good three or 4 weeks. And then once you're kind of done with that phase, you don't have to revisit that. Like you can kind of treat it and be done with it. And then after that, if the swelling and the puffiness is still there, then I would start treating it with like a German chamomile. German chamomile or maybe potentially milfoil, but German chamomile would be my first choice.
Same
Because I have no space.
Yeah, and you would use it
knuckles.
topically in like a massage oil, like make it an ointment and then rub it on the hand.
Yeah, I have no space in between those first two knuckles, and it's been painful for a long time.
You have like no space like between the two metacarpals.
Between the two knuckles, it's just very uncomfortable.
So so still do the helichrysum. I think that makes me want to double down on the helichrysum. Like really do the helichrysum in there, and then I mean take your hand like so, and then start like kind of pinching in between the joints. And at first you're just kind of pinching. You're going like this front and back side, you know, so you're going like this. Then after maybe a week or two of doing that, when you get your fingers in, the one on the top, kind of move it side to side. You see, like I'm not moving it on the skin, but I'm just moving it like the tissue underneath. And what you're doing is you have these like kind of like little U-shaped muscles in between these bones in your hand, the metacarpals. And so what happens is they can tense up really bad and they bring the bones closer together. And so that doesn't allow for proper nerve flow down to the hands and fingers or proper blood flow. And so by going through and like kind of pinching that, you're kind of like massaging it. And you're also kind of manually spreading the bones apart a little bit. And at first you're just going to pinch. And then after a week or two, after it starts to feel like kind of comfortable, then you're going to get in and like move the finger back and forth. So they actually make a tool. I don't know if I have. They actually make a tool that's like a little T-bar, and it has like a little rubber grommet that comes down to a point. And actually what I used to have people do is go to the school supply section at like Walmart or like Office Max or something and get one of those old school pink erasers. and you can use the eraser and get in between, and then like, you know, push down, and then, you know, like you're just doing a little bit of a gentle twist, because what you're trying to do is you're trying to spread those bones apart. But I wouldn't do that right off the bat. I would do the thing with the fingers first, like pinch, then pinch, and like kind of wiggle back and forth. And when you feel like it could go deeper, then you could switch over to the eraser. I can try to find if I might have a few of those T-bars laying around, and if not, I can try to find, I think the company that used to make them went out of business, but I still see them floating around sometimes. And so, yeah, we can try to find you one, and I can walk you through how to go through and do that. It's real
Great,
simple.
yeah.
Yeah.
I've lost a lot of function in my middle finger because it's
Yeah, I
that's the
bet.
one that was mainly
Yeah,
affected, and it curves actually, but it kind of crosses over my ring finger.
Yeah.
So it's just become really weak.
Anytime there's like a hand issue like that, like you'll almost always have to treat the muscles between the bones in the hand.
Okay, thank you so much.
No, you're so welcome. You're so welcome.
And then go ahead, Barbara.
Hey there.
Hey.
Thank you for the neck exercises yesterday. And this
Was that good?
It was great. And I look forward to the video so I can do it with some authority on my own. This one's a follow-up hand question. Actually, it's about the wrists. Sometimes when I'm holding, say, a half-gallon jar of water, I get the sharp pain in my wrist and I feel like I'm at risk of dropping it. And I don't know if a nerve is getting pinched but I'm assuming there's an exercise to do to free that up,
so does it ever feel like your wrist catches?
Yes.
Okay. And okay. So we're gonna like okay. So you take some sort of oil that's antispasmodic, and you see like, okay, this is the side with my thumb, this is the side with my pinky. Right. You're not quite all the way to the side, and you're not quite on top. You're like at a 45-degree angle. You're going to put the antispasmodic oil like all along this like line from the palm here, and then slide your hand underneath, and then you're going to kind of like push in and then up, and then in and then up, like in and then up.
Meaning towards the center of the arm?
Yeah.
Okay.
And if you kind of poke around, there's like a big muscle that runs along here.
Yeah.
You feel that?
Mm-hmm.
That's the problem. And so if it gets real tight or gets a trigger point, it basically throws off how the wrist tracks, and it will feel like it locks up, and you'll actually start dropping things, and it will feel like sometimes you need to like pop your wrist, or that there's like a bone out of place or something. It will actually even make a couple of the bones in the wrist actually start to hurt somewhat. Like if you push on them, the bone area will be tender.
Right.
But it doesn't always happen, but it can. And so if you just kind of get in and just, you can kind of twang it back and forth, but you just keep working that muscle with usually a couple single treatments, between the antispasmodic, and you can also just like rub it back and forth. But there's something to be said about compressing and then letting go, compressing, letting go, compressing. Especially about mid forearm is where you can really feel it gets really super tight, and then a little bit higher, but you still want to treat the whole line right there. If you treat that will probably go away in a couple of trerectreatments.
Okay, and should I do some maintenance or just do it whenever?
From time to time, like, once you kind of do it, like you won't think much of it, but you'll start to feel it kind of coming back, and you can just do the maintenance when you start to feel it coming back. At first you might want to treat it several times until it feels really good and the wrist feels really good. And then from there, just whenever it flares up.
Okay, so if it feels like a nerve sometimes, but it's not, it's more.
No, it's a
Okay.
trigger point.
Yeah,
Well,
okay.
because like a trigger point has a referred pain pattern, which is like that is actually neurological. That is anytime where pain's referred, that is a form of nerve pain. And so it can still be achy, can still be whatever, but trigger points are a whole nother ball of wax. And so it just means that there's a trigger point in the area. So, you know, all that means therapeutically is you just might have to treat it a little bit longer. And that's about it.
Okay, thank you.
Yeah, keep me posted on that. If it doesn't respond, then we'll do something a little stronger, but that's usually plenty. Like
Okay.
rarely do we need to take a next step.
Thank you.
You're so welcome.
And go ahead, Dorothy.
Hey, Dorothy.
Hi, good morning. I would like some more information about the birch complex to use for general pain. Like, how do you decide when to use that for general pain as opposed to another pain product?
Well, I would use it to actually augment the other pain product. So like you could use it by itself, but a lot of times you can apply it directly to the site. But I would put, like, if you have dull achy pain, the regular pain relief, or if you have nerve pain, that, or if you have something where there's a lot of spasms, you can use the pain relief with the antispasmodic. And then put the birch complex on the wrists. You know, like roll it or put several drops there and then just rub it together like that. And regardless of where you put it, the birch complex actually will start to reduce pain regardless of where it's at in the body. Like, so the wrist, the top of the feet, you could put it on the temples, but I'd probably go for wrist or the top of the feet. And, you know, you can call it good. If you want to put it on the site, do it in a rotational approach with the other oil that you're using. I mean, it can stand on its own, but at the same time, you know, with pain, sometimes I like to really rotate the different pain blends just so you kind of unwind it from a lot of different levels. And, you know, we talk about them like from the point of view that like there's this type of pain and that type of pain. Sometimes there's like overlapping layers of pain. And so I just like to go through and just unwind it from a lot of different ways as possible. I actually use even pain blends sometimes, like to like prophylactically, like to like prevent pain. Like I'm not having any pain in my back, but I, you know, put a bunch of one of the pain blends on my back because I want it to stay that way. You know what I mean? And it's like, if you keep making it like healthy in that way, that like when something does happen, like you strain your back, or, you know, you got a situation where you get spasms from time to time, or you have bone on bone, it just, you shake it off much faster, much easier, you know, where before, like if my back got triggered, it would be days to even weeks sometimes before I would start to feel regulated. And it happened like 3 or 4 days ago. It lasted, I'm not joking, like 10 minutes, and then I'd already shaken it off. And so that's just constant, like, you know, applying things to the back and you know, salt baths with something in it, and even Palo Santo can be thrown into that mix. You know, it's not necessarily a pain reliever, but Palo Santo or coffee is really good because it's very cleansing, and the coffee especially stimulates a lot of lymphatic movement, and the Palo Santo just helps the body with stress. And being in pain is, for the body, very stressful. You know, emotionally, mentally, you might not even really think about it, but your body is in a stress state because of the pain syndrome. So.
Thank you. And also, what about spasmophilia? I'm not sure when to use that.
You could use that anytime where you're trying to address spasms in part of the body, especially spasms that get aggravated with movement, emotional states, stress states, activity, anything like that. It works really well for.
Okay, well, what you're describing, I would have chosen antispasmodic, I think. So I guess I'm not sure the difference of between those two.
Spasmophilia would be aggravated with movement, with emotional states or stress states, where spasmodic would be a spasm that's there regardless of the state. Like, like it's just kind of there and you're having a cramp. Spasmophilia would be for the time where you're feeling fine and you get up and move around, and all of a sudden something starts to go into a spasm.
Okay.
Does that make
okay.
sense?
Yes, thank you. Well, and while I've got you, what
Sure.
about the kidney and low back ointment? I'm not, is it for spasms, pain, and muscle relaxing? I don't really know.
It's for the fascia that is in the low back and the kidney area. A lot of times the fascia that's around the kidney that supports the kidney is in a bit of a spasm and can throw the low back into a bit of a spasm. And so it's mostly to treat that area.
Oh, okay. Well, since it's for spasms in the fascia, would you use
It's actually very specific for the kidney.
Oh, got it.
Very, very specific for the kidneys. Like if you put it on your shoulder, probably not going to do very much. Like it is really geared towards the kidney area.
Which one was this? Sorry.
Kidney and low back and kidney.
Oh, that was that.
Okay, for the muscles around that area, right?
It's actually fascia, but
fascia. Sorry, right, fascia around that area.
I mean, we're splitting hairs here, but like if we're talking about it, it's not so much for muscle, it's for fascia.
Okay, thank you very much.
Okay, and go ahead, Robert.
Hey, Robert.
Hello again, Greg. I love what this weekend is and all the questions and answers.
I'm loving that you guys are loving to ask like questions and stuff. I mean, I love this. I love it too. Like I'm
right.
Having a good time. Yeah.
We sit in on the Tuesday study groups, and you never know how many questions people have built up to ask until you have something like this.
Right.
And then, I have my questions about my conditions, the conditions my body experiences. And then I sit here and listen to other people and say, ooh, that could help me too. And that could help me. And pretty soon I have a list of 50 oils to order, and I could be doing oils 8 hours a day, 7 days a week.
See, where my brain goes is like, I think I have that too. I think I have that too. I think I have that too.
So how do
I have sickle cell anemia and I'm white? It's really weird.
How do we balance? How do we find time in our day to do these or prioritize? I don't know how to say it.
Yeah, a lot of times what I do is I'll target like one thing and I'll work it for a little bit and get it kind of feeling good, and then I'll move on. When you're talking about like something like cholesterol, that's very long term, and so that's also something that you're not really aware of until you go to the doctor and get blood work done and things like that. But like when you're talking about like muscular issues or cognitive function or your memory or like your immunity, fatigue, I treat it until it gets better. And then, I like the idea of then at some point rotating and going either deeper with it or treating something else, because a lot of times other things are also contributing to that health issue. So I just start with the thing that is causing the most discomfort or the most, like the biggest problem, and I start unwinding that. And then as that gets better, I move to something different. And if it's non-responsive, then a lot of times it's because of another issue. Like, it's because of something else going on. So then I start going, okay, if there's too many things going on with the body, one of the very first things you can do is go to like rosemary, verbena, lemongrass, lemon, or sage. All of those are considered cure-alls. And basically when the body is just so out of whack, you can go to those things and you can start treating to balance out. And so for me, like I used to do it with lemon, but now I do it with rosemary, verbena. Just from like about every 2 or 3 months, I'll do like maybe about a week of just doing rosemary, verbena as like prevention. you know, like I'll take it internally, or I'll put a whole bunch on my back, or, you know, something like that. And, you know, after a few days, I'm like going, okay, I feel good. I'm moving on. And the thing that's really nice about rosemary verbena is like, if there's a bunch of just like different issues going on in the body and you're not quite sure what's what, rosemary verbena is like kind of the go-to thing. And it helps you kind of almost like pick a path of like how to go through and treat it. And you know, it's real easy if there's like a whole bunch of things going on just to do this big shotgun approach. But I like to see like if something's working, so that if you're doing it, you know that it's producing a result. And so a lot of times if you just start treating one, you can get it going. And even if you keep treating it, like, you know that it's working, and then you move on to something else, you can still keep treating it, but then you move to something else and go, now let's find something that's going to treat this. And then you start treating that. And so a lot of times, you know, the idea with the oils are, you know, you're mixing energy medicine with physical medicine. So it's a very accelerated way to heal something. And unless you're dealing with degenerative conditions, really chronic conditions, or you're doing some sort of maintenance, a lot of times you can change it up after a while. Like, you know, the body gets better and you can either take it deeper, do maintenance, or move to something else. And so I would start and just target the biggest thing causing the problem, treat that, and then move on from there.
Okay, so in essence, it's like a series of experiments.
Yeah, I mean, like I'd say like medical aromatherapy is part science and part like art. Like, you know, you're experimenting, you're treating, you're trying to produce a result, but also like how do we apply it? What about these other factors? How's it affecting the cognitive function? You know, how is it making me feel emotionally and mentally? You know, you can take all these things into account. And, you know, some things are just going to resonate with people. Like, you know, for me, like one is basil. Like I take basil every day. It's been every day for decades. And, you know, it's just, it's a good cerebral stimulant. It's good for the mental functions. It reduces stress. It reduces spasms in the body. You know, it just does a lot of great things. And for me, basil just like it's nice. And it's not like, I wouldn't even say it's one of my favorite oils. Like I like it, but you know, I'll go to fancy things and say, oh, these are my favorite oils, but basil is always there. Like, you know what I mean? And helichrysum is another one for me. I really like helichrysum. I might not use it every day, but I use it a lot. And you know, you'll have some things that maybe you're doing maintenance with, but still, even with me doing maintenance, I still go through and, you know, I'll treat my back, I'll treat my immune system, I'll treat brain fatigue, I'll treat, you know, whatever kind of feels like is going on, and, you know, go from there. So.
Okay, great. Thank you very much.
Yeah, you're so welcome. Yeah, we kind of learn from each other's questions and the situations and yeah.
And then go ahead, Cindy.
I was curious, yesterday we were talking about different kinds of pain, and when there's a dull, achy pain in the feet.
That's probably nerve pain. Like dull, like kind of like a toothache.
Kind of.
Yeah, I would say that given that it's the feet, I would say that's probably nerve pain, and that's coming from probably the hips or the low back. So the nerve pain blend, or like peppermint or some sort of mint, like directly on the spine, and I would put some on like the sides of the hips and the butt cheeks a bit. And then you could stick with that on the hamstrings, or you could start to put something on like a little bit more antispasmodic, like something like marjoram or basil. I really like, for the hamstrings, I really like pepper. like I think pepper works really good. It releases fascia, it's antispasmodic. The other one that I like for the hamstrings would be wintergreen. Wintergreen's antispasmodic, but it also helps to unwind like really chronic spasms. Like wintergreen is really good for that. Like it's not just antispasmodic, but it's used to unwind like deeply held spasms in the body.
Okay, thanks.
Yeah.
I have one more.
Sure,
Are
fair.
we going to talk about the skin?
Yeah. We'll probably do it after lunch. Yeah.
Okay, all right. I
Yeah,
have a question about that if we don't cover it.
Fire away right now. Go ahead.
So I had a lot of stress at work, and most of my life I've had like a psoriasis on the scalp.
Right.
But when I'm not too stressed, it goes away almost.
Okay.
And then when I'm stressed, it comes back really bad. And then the last few months, I was working with a manager that I was really stressed with. Our personalities didn't click. And then I just changed jobs. But during that time, I started developing it on the rest of the body.
Like on the elbows and knees, or you starting to get it like on the torso, or?
The elbows and knees, and just a little, not a lot, just a little bit here and there, but that lets me know it's really bad.
Okay. And what about on the knuckles or anything like that?
Not on the knuckles.
Okay. And are your joints achy at all or anything like that?
Sometimes, not always.
Not always. Okay.
Not always.
Okay. You know, psoriasis is it's like it's a trickster. Like it's very tricky. And so there's not like one where you go like, this will knock it out. You kind of have to start playing with things. And over the years, we've tried lots of different things, and we have a couple things that have helped. And so one being that sometimes, like in the middle of an outbreak, spikenard can be very helpful. Like you can put it neat, like directly on the situation where there's a bit of an outbreak. You know, you just take several drops and rub it on the scalp or on the elbow. You could put it in like a lotion or a massage oil as well. This has a kind of a two-pronged effect. It's very balancing to the skin, and you know, psoriasis is an autoimmune issue where there's an overproduction of skin cells. And so the idea being the spikenard has that balancing effect so that maybe there's not the overproduction of the skin cells. And then it's also sedating, soothing, and the other thing is spikenard reduces stress. It changes the stress response. And so the thing that you could do is also inhale it. And I would put a decent amount of spikenard on the feet. You know, like put several drops in your hand with a little lotion and rub it all over your feet. And the thing with the feet is you're hitting like neural receptors that will affect the whole body, and it's a way to calm down and soothe the whole body very, very quickly. And so to pull the body out of stress response, if you do that on a regular basis, even in times where you're getting stressed out, you'll notice that like, I used to get way more stressed out here. Like I'm stressed, but like I'm not like reactive stressed. You know what I mean? Like you can almost like take a pause and go, okay, I'm not going to get as worked up here. Because the stress response is, I mean, this is the thing with stress is 95% of the time, it is actually a physiological response that then produces an emotional response and then a mental response. So if you can calm down your physiology, a lot of times it will calm down the whole chain reaction. And so the spikenard on the spots will be helpful, and then spikenard in inhalation and on the feet can be helpful. And in times when you're under a lot of stress, put a couple drops on water and drink it. Like I mean, I do that whatever, like even sometimes just the stress of traveling, like I'll take a couple drops as I get on a plane just because I want to conk out on the plane. And so all of this can be very helpful for the breakout. And then we actually started making this like soap just as like I don't know, it was like an experiment. And then I don't know, we were putting in orders whenever we had it, and it was parsley basically in like a hard bar of soap. And we had people who had psoriasis that would scrub the sites with the parsley soap, and it was significantly reducing the outbreaks. And so I'd still use spikenard, but I would probably rotate in parsley. And parsley is really good for the skin. It's a very good detoxifier. I wouldn't have gone there with it, but then when we started, I mean, we didn't have like one or two people. I mean, we had like dozens of people coming back to us saying like the parsley soap is knocking out the psoriasis. And so that's pretty consistent. I mean, especially for psoriasis, because it's really hard to get a consistent thing that knocks it out. I would put several drops in your shampoo and do the head, and then let the shampoo be there for a little while. You could use it in a salt bath, you could use the soap, or you could just put it in lotion and rub it on the area. Any form of that, you know. So I'd say the go-to things would be spikenard and parsley.
Okay, thanks. And for the scalp, I notice it's really dry when the cells, when there's a buildup on the scalp. What's the best oil, carrier oil to use?
Carrier oil on the scalp. I want to say I used sesame oil, like as like a little bit of a rub, or argan oil.
Argan, ARGON. Okay, thank you.
And I want to say that I think I have something for dry scalp too. Let me look that up. Huh. I thought I had something for a dry scalp. I didn't. Hey, in my notes, I also have Cajeput for psoriasis.
Can you spell that?
CAJEPUT. Cajeput or Cajeput is in the Maluka family. It's in the tea tree family. It smells a bit more like Neoli, but used in pain syndromes. And I do remember using Cajeput like a long time ago for psoriasis, but it's been a while since I've used it that way.
Thank you.
And then go ahead, Angela.
Hey, Angela.
Hi, so I had a couple repetitive knee injuries. So you know how you have to limp, and I think it kind of destroyed the fat pad under my left toes there. And what's ended up happening is a couple of my toes have actually kind of curled up. They don't stay down. And,
yeah. Okay.
What do I do with those?
So you want to use, you're going to have to like experiment to see what's going to work best. But like I'd rotate either like spikenard, vetiver, marjoram, basil. I'd probably go to pepper first. That would be my first choice. And you rub it all along the shin. Like rub it on the area from below your knee all the way down to your ankle. like from the bone all the way out to the side. But there's a big muscle like right along the shin bone. It's called the anterior tibialis. Like really cover that. I would just put it on like a knead application and like rub it in. Like do that. It's gonna take a little while, but basically that contracts and it starts to draw the toes up.
Oh, interesting. Yeah, because when I push on the metatarsals, it kind of hurts, but it kind of
Yeah,
feels good.
yeah, it's because you're pushing on the attachment sites, but it's like if you follow it up, it kind of goes up the shin. So if you unwind that, like it should start to loosen up down on the feet and the toes and all that.
So pepper alone, not all the other
Yeah,
ones. Or those are just all
pepper.
other-
I mean, I would probably like rotate them, but like pepper would be my go-to one. But marjoram would be in that mix. Basil would be in that mix, and either vetiver or spikenard. I like vetiver just for this application, just because vetiver is also a circulatory tonic, so it will increase blood flow to the tissue, and it's a really good muscle relaxer. So.
Awesome. Okay, thank you so much.
Okay. So I think we need to break for lunch. I have the thing with Astara at noon. And so we'll take a break. We'll come back at 1:30 and we'll continue with this. If you guys want to do just Q&A, we can do that. But we'll talk about skin. We'll talk about psychological healing. We'll talk about respiratory. We'll touch on a bunch of things. We'll cram in as much as we can. And this isn't going to be the only time we do this. We're going to actually do this kind of semi-regular. So, and each time I'm going to keep adding more to the booklet. So,
Letty, would you mind reposting the star link?